Actress Angelina Jolie's public battle with breast cancer led to her decision to have a double mastectomy. Now, more and more young women are making that very same choice. Here to talk to me about a recent study from the American Cancer Society showing an increase in double mastectomies is Dr. Phillipa Woodriffe. She's a surgeon at Riverview Medical Center in Red Bank, a breast cancer survivor, and an American Cancer Society volunteer on their board of advisors. Doctor, thank you so much for being here.
Thank you.
I looked at the study, and in almost every age bracket, the number of people choosing to get preventable double mastectomies has tripled in the range. I don't know whether that's encouraging or alarming. What is it to you?
It's actually a little bit of both. It's encouraging that people are aware that there are certain groups that have a higher increase of the likelihood of getting breast cancer on the other side, but it's alarming that more people are choosing this who really do not need to have the second mastectomy.
I read that it's a 6% chance of getting the disease in the second breast. So it's a rare instance, right?
It's rare, but it's percent per year as it goes on. So there are some women who, because of the genetic predisposition, could have as high as a 30 or 40% risk lifetime of a recurrence. Because the risk maybe this year is only 6%, but if it's a 20-year-old who has to go to the age of 80, by the end of their lifetime, it's a much more significant risk.
Now we have another scenario where someone, as the BRCA gene shows up in testing, and they make the decision to get a double mastectomy. Is that, in your opinion, a wise choice?
That's what we call totally prophylactic mastectomies, where they've never had cancer before, but they're positive for the gene. They have a lot of family members who've had the disease, and they choose to have a mastectomy. That's a group that, yes, we do the bilateral mastectomy for them, but there's a significant amount of counseling that should go on before that decision is made.
And then there's some other people who don't have that testing, that come to you because they feel like they have a family history, or they're just concerned about it, or, and you can tell me if this is the case, they don't want to go through all the mammograms.
If you have a person who has a strong family history with multiple family members with breast cancer and also ovarian cancer, which has a very high relationship to the genes, they may still choose to have a bilateral prophylactic mastectomy. A person who may have had a tumor in teenage years where they have radiation to the chest wall is at a significantly higher risk and may be a candidate to have bilateral prophylactic mastectomies. So there still are indications for it. Each individual has to weigh it for themselves.
But can't someone get just treat the disease and get a lumpectomy? Is it a mastectomy? And do you counsel that?
Absolutely. The cure rate, if you have an early stage breast cancer, by treating it by lumpectomy and radiation versus mastectomy, is the same. There actually are some studies that show that lumpectomy and radiation may be slightly better. Okay, so yes, in that instance, to treat that cancer, the mastectomy is not the primary issue. The reason that people are doing better is not because surgeons are doing a better mastectomy. It's because we're adding hormone management, we're adding chemotherapies, we're adding better radiation, which cures the whole patient. So it's not just the breast, we're treating the whole person when you have a cancer.
You are the person, you're one of the people that has to counsel women that when they come to you and try to make this decision, and you have a lot of credibility on this because you had to make this decision. Mm-hmm. What do you tell women?
I tell people that they have to think about, one, when they get up in the morning and take a shower and they look at themselves, is a small indent on the breast going to bother them more, or a large incision on the breast? I worry about the impact of the bigger surgery. For example, if you have a mastectomy and you're a diabetic, you have heart disease, it's a much bigger operation. You have much more risk for infection. All of these things have to play into the decision because, as I said, the radiation and lumpectomy does have as good a cure rate as a mastectomy. So that alone should not be the decision making.
Wonderful. Doctor, thank you so much. We could have talked forever. I really appreciate it. Dr. Phillipa A. Woodriffe, a surgeon at Riverview Medical Center in Red Bank, a breast cancer survivor, and an American Cancer Society volunteer on the Board of Advisors. Still to come on Another Thing, in search of missing persons, Dawn meets the heroes who are on the front line.